At the University of Toledo, we are surrounded by experts. And we tap into those experts here on Rocket Talk.
Soon, parents will have an option they didn't have before. Pediatricians will ask, do you want your child to get the COVID vaccine? Here to discuss, Drs. Deepa Mukundan and Valarie Stricklen. Dr. Mukundan is an infectious disease pediatrician and faculty member at the University of Toledo College of Medicine with inpatient and outpatient practices in Toledo. And Dr. Stricklen is a general outpatient pediatrician, medical director, and faculty member of the University of Toledo College of Medicine. Thanks to both of you for joining us today on this very, very important topic. Dr. Stricklen, I want to start with you. What's your message to parents who may be hesitant to vaccinate their children against COVID?
Probably get the vaccine. Honestly, it's one of the most important things you can do for your child. As we have it available now for the 12 years and older, go out and get it today. And as soon as it comes out for the younger ones, get it then. No hesitation.
Dr. Mukundan, for the younger children, what's in that vial? Is it the same vaccine that we received?
The dose is little less. The quality is the same. The protein that in the vial is the same, but the quantity is a little less. So with that lower quantity, we have Pfizer has already done its trials in the 5 to 12-year-old age group and has submitted that information to the FDA. So we're waiting for that information. So it's essentially a lower dose but the same protein.
At least at first, children weren't getting as sick with COVID, or they weren't getting COVID at all. So are you worried that some parents may say, well, it's not that bad in kids, and that at least a third of parents, according to polls in the U.S., will not vaccinate their children immediately. They're going to wait a while. Does that worry you?
Yes. The thing is, the FDA and the vaccine companies are very concerned about safety. So it's not going to be out for public use without addressing all those safety concerns. And I think most parents are also concerned about safety and adverse events. There would be some adverse events like we adults experienced, but that is better than getting COVID. Now, to address the issue of getting COVID in children, the number of infections are much less than in adults. We've seen serious infections, and when community transmission increases, which sort of suggests that there's a lot of virus in the community, then children tend to get more infections. So it depends on where you are and how many people are immunized and what's the extent of the viral infection that's going around in the community to see whether children get infected or not.
Yeah, I wanted to ask both of you, what's the youngest case you've seen?
I had in the office a 3-year-old. That was the youngest, and that's sad. That honestly wasn't super sick, but you hate to have to give that news to the parent and say, now, make sure everyone's washing their hands, wearing their masks, stay safe. Hopefully grandparents don't get it, parents don't get it, the other siblings don't get it.
The youngest I've seen is a newborn, and they do get symptoms. The symptoms are not serious enough, but there is some reports in literature that you can get serious infections in the newborn period. Again, if the virus activity in the community is low and there is good levels of immunity in the community in terms of vaccine immunity, chances of the little babies getting it is much less.
When we're talking about children being vaccinated, it's ages 5 to 11, right?
Mm-hmm.
So what message do you have to parents of children under 5?
So under 5 at this point in time, again 5 to 11 has not yet been approved. The FDA is looking at the data. We hope the approval will come sometime middle of November. Less than 5, currently what we have is to immunize the adults around the children so that the children do not get the infection. If children get the infection, they transmit infection, which again increases the infection in the community, and they can also get complications due to the infection, which we have seen in Toledo.
Dr. Stricklen, let's say you have a group of kids soccer team, classroom, and they all get vaccinated. Could the masks then come off?
When you're vaccinated, then yes, you have more protection. But when you get into a large group, indoors or even outdoors, you have to still worry about that virus being spread.
Even if they're all vaccinated?
If they're all vaccinated, you have a much less risk of it, for sure. We saw that happen when the mask mandates came down because we started to have more vaccinations. So if you can have everyone be vaccinated, that's the best. But the likelihood of all of that is pretty low.
Dr. Mukundan, will children need boosters?
Don't know yet. I'm assuming they will, but it's way out there, maybe 8 months to a year. We will have that discussion, but not right now.
Okay. So we're talking still about herd immunity in this country. Will vaccinating the younger population, will that help us get closer to herd immunity?
Oh, absolutely. Absolutely. The more people that can be vaccinated, the better.
What should schools be doing? If you could advise school leaders, what should they be doing to protect their children? And do you think that most schools will make it to Christmas break with in-person learning?
So that again depends. Again, decreasing the risk is multi-layered. It starts with vaccination, mask, safe distancing, good ventilation, indoors versus outdoors, community transmission of infection, what is the community level of infection. So a lot of factors go into the decision what schools need to make in terms of whether they want their children to be masked or not. Definitely vaccination, there's no question about it. That's the best we have to decrease risk. But even with vaccination, you may have to take all the other measures to sort of get past this pandemic.
Well, speaking of other measures, Dr. Stricklen, as we approach the holidays, people start planning trips maybe across the state or across the country. What advice do you give parents as they plan for the holidays?
Obviously, get vaccinated as fast as you can. Wearing masks when out in public, when on public transportation, making sure that kids are wearing their masks. Every child should be wearing a mask age 2 and up. So wearing those masks when you're out in those public spaces really can help decrease the transmission.
So when kids come together, let's say for a Christmas party or something, and they're all kind of playing in the same room, should we still be wiping down toys and that sort of stuff?
So the highest rate of transmission happens by aerosolizing, but every measure does decrease your risk. So should there be one kid who was positive, then it does appear in the saliva and other secretions. So wiping down stuff is really a good measure to decrease overall risk. But making sure that the room is well ventilated and they are well separated out would be the best option to mitigate the risk.
Do either of you have children?
I have a 13-year-old.
Okay. If you had younger children, would you mix them with other kids, birthday parties, that sort of stuff?
I would. Well, it depends, I guess. Hoping that their parents were vaccinated, and when this becomes available, that the younger kids are vaccinated. I have parents ask me that all the time. Of course, you want your kid to lead a normal life. You want them to have fun and do the things that kids like to do. But really, I think it just depends on what the other kids, is anyone sick? Do they show any signs of illness at all? If so, it's probably best to not do like those indoor parties right now.
Okay. Are you worried about flu season? Because some of the symptoms of flu, similar to the COVID symptoms, are you worried about that?
Yes. Last year we did not have a huge flu season just because we had all the measures to mitigate transmission of the flu thanks to the pandemic. But this year things are opening up thanks to the immunization and more education and more information around. So we do worry about the flu season and similar symptoms. We do have good tests to tell us, to differentiate between the two. Otherwise, symptomatically, they're pretty much the same. So it can be a challenge, especially in a primary care clinic, where kids can come with, runny noses and fever. So having some rapid tests there would be very useful for them.
Do you have anything to add to that?
Yeah, so we do have rapid tests. We have a rapid COVID test in our office. We have a rapid flu test in our office. But it can be very difficult to tell the difference. Treatment-wise, it's not going to really change. It's a viral illness. It has to run its course, but we always tell parents to treat the symptoms. But we do have those tests to try and differentiate it.
And again, in about 15 seconds for each of you, what advice do you give to parents? What message do you want them to take away from this?
The message I would like to give is risk mitigation, which is decreasing the risk for COVID, is multi-layered. The most impactful is vaccination, and the other steps have to be taken in the context of what's happening in your community, which would be masking, safe distancing, hand washing, having good ventilations.
And in about 10 seconds, I'm sorry, we're almost out of time. What's your advice to parents?
I know that it can be scary to think about doing this vaccine that's new, but it's been well tested, and the risk of getting COVID and its illnesses that can come later are worse than what you would get with the vaccine.
Doctors, thank you so much for coming on this program and for the work that you do in the community. We so appreciate you. Thank you for watching Rocket Talk. We'll see you next time.